Noel Coleman, and I'm the president of Doctor.com. And we're on a mission to make accessing care as easy as shopping on Amazon. And to date, we work with a couple hundred hospitals and tens of thousands of private practice physicians.
I'm Paige Wickner. I'm a doctor at Harvard, Brigham and Women's Hospital. I'm one of the quality and safety directors for our hospital, and I run the patient experience and patient-family relations. I'm also a practicing allergist, and I see patients 1 day a week, and internal medicine and allergy patients on our inpatient service.
So today, we wanted to tell you a little bit about how the partnership between Brigham and Women's and Doctor.com is changing the experience of physicians and patients. Imagine a world with me where a young woman finds out that she's got breast cancer. And when she gets home, she's able to pull out her phone, and she says, "Hey Siri, pull together a care team to manage my breast cancer treatment and recovery." See, today she doesn't know how to do that. Eventually with Doctor.com, she will. But think about that. Like, what does it take to have something like that happen? You've got to have a lot of different data points. You've got to have physician data, location, patient experience. You've got to know something about scheduling and availability. You need to know outcomes data. You need to know something about what kind of referral patterns physicians have, prescriptions. You got to have a lot of different information. This is really complex stuff. But when you have that, then you can begin to pull together a care team in moments for that young woman and be able to give her a care team that's personalized to her needs and, very importantly, to the goals in the way that physicians work together to be able to collaborate more effectively. And so where do you start with this? So when we started working with Brigham, we worked in 3 distinct areas. We really started working with them on their Find a Doctor tool, and then we worked with them on pushing that data out to third-party sites like Healthgrades, Vitals, Google, Yelp, etc. So why do we start there? Well, it's because today, this is where patients are looking for care. This is where they're going to make their decisions. They're going to find this information there. And by starting in this place, we can begin collecting this data and building better interfaces, better processes for them to be able to find that care. But then, very importantly, we began to engage the physicians and transition by helping to build in their survey data at a provider level and turn that into star ratings and patient comments so that the physicians can become engaged with the idea of patient experience and the importance of it and how it helps people be able to find the right care at the right time.
At Brigham and Women's Hospital, we have 1,500 doctors, we have 18,000 employees, and we see millions of patients a year. But it's really hard when you're sitting as a patient with your doctor to give them direct and honest feedback at that moment, especially if it's a doctor you want to continue to have care for you. We chose Doctor.com as our partner in this endeavor for our physicians because their platform really allowed us to provide all aspects of a powerful matching experience for our patients, both on our sites and across the broader web. Their team has really provided unparalleled data management and responsiveness as a partner. But engagement is really messy, and it's really hard to receive feedback. When I talked about this project with our faculty, and I met with every faculty member before we started, some people were really upset. Some people even said, "How dare you think about posting something negative about me as my employer?" I remember the very first time that I got a negative patient comment myself. It was about a patient who I'd prescribed a medication, and they hadn't understood my prescription instructions or why I was prescribing it. Now, every single time I prescribe a medication for a patient, I ask them, "Do you understand why I'm prescribing this for you? Can you tell me what it's for and how to take it?" So in this way, our doctors are using the voice of one patient to improve their care and the experience of patients moving forward. I had another colleague who had a pattern of comments on our website about how terse and rushed her visits were. When leadership met with her, it was really clear she was burned out. Her department worked with her, and they said, "Well, how can we improve? We need to give you less clinic. We need to give you more time with your patients." Now her wellness and the wellness of her patients are improved. We hear a lot in healthcare about the moonshot for healthcare as being the right patient at the right time in the right location. This sounds great and this is important, but it's not enough. You need to have provider bandwidth. You need to have high quality, safe care, and you need to understand the importance of patient experience. Our partnership has really done this for our providers at our hospital, and it's really this collaboration of provider wellness, patient experience, and healthcare that really is going to provide amazing care moving forward.
Yeah. And if you really think about the process of connecting physicians and patients, this is a really complex decision for people to be able to make if you're really going to choose the right care at the right time with the right physician, and you're going to be able to have that personalized care. And so the challenge is, too, is that there's a new problem. You've heard a lot of great things this week as people have talked about clinical innovations and lots of different things that they're doing to improve care, and it's amazing what's being done. But if the person can't access the physician, they can't find the right doctor for their care, then they don't necessarily benefit from any of that. So this is a first order challenge. And as more procedures are come up with, more technologies come out, more physician specialization and things that continue to proliferate, that problem only becomes more complex. And so what we've done as a society is we've gone from something that was very simple originally to creating a new paradox of choice. So now instead of just having the terrifying experience of having to experience care in the first place, they first have to go through a really frustrating and confusing time just trying to find out what the care is that they need, right? And this is a problem that we've just absolutely have to solve. And so by starting in a place where patients are today and working with an organization like Brigham and Women's that's clinically renowned around the world, and patients are coming in to be able to try to access and find the different physicians that they can receive care from at this organization, we've been able to use the basics of something that's basically a marketing strategy up front to begin building the connective tissue for how to change the fabric of how patients and physicians are connected. So in a very literal sense, we're building the engine that makes shopping for personalized care as easy as shopping on Amazon. Thank you very much.
Thank you.